In this presentation, we will discuss paraneoplastic stiff person syndrome in detail. First, I will explain how I was exposed to this disease and why I decided to research it. We will cover the basics of cancer, the reasons it develops, as well as the basics of the immune system and how it should normally respond to cancer cells. This is because this disorder is directly tied to cancer and also the body's immune response. Lastly, we will go through and discuss paraneoplastic stiff person syndrome, going into more detail about symptoms that are seen in patients, what type of immune response is causing the syndrome to actually take place, treatment, as well as other areas of research in the topic. Many times when we discuss cancer, there's a possibility that most people have some experience with the disease, or through personal experience, or through experiences that a loved one has had. This happens to be the case for me as well. In 2015, my grandfather was diagnosed with stage 3 colon cancer. But the problem with his case was he was not only battling cancer, but he was also battling a disease called paraneoplastic stiff person syndrome. His basic timeline was as follows. In January 2015, he was diagnosed with stage 3 colon cancer. He suffered from knee and shoulder pain, as well as distorted posture and inhibited coordination approximately a year before his cancer diagnosis. As you will see, this is common with this disorder because many times symptoms arise before the diagnosis of cancer. A colon resection surgery was performed to remove the actual tumor in his colon, as well as a 6-month cycle of chemotherapy. After his chemotherapy, his symptoms of pain, posture, and coordination got worse, and he was officially diagnosed with paraneoplastic stiff person syndrome in February 2016. He passed on May 2, 2016 due to complications with paraneoplastic stiff person syndrome, as well as other system failures. There needs to be a basic understanding of two components that make up paraneoplastic stiff person syndrome, which is cancer, how it develops, and secondly, the immune system. First, cancer is when the cells of the body have uncontrollable cell growth and division. Tumors can be classified as either benign, meaning that they do not invade the basal membrane and they do not go through the process of metastasis, or they can be classified as malignant, which means that they have invaded the basal membrane and they can go through the process of metastasis and spread through other tissues of the body. Through time, we have learned that cancer is a genetic disease. It is caused by either genomic changes or epigenetics. So genomic changes are changes that happen in the DNA sequence that changes it from an actual wild type that we see. These changes in DNA sequence can activate proto-oncogenes to oncogenes, which promote cell growth at an abnormal rate. These changes also suppress tumor suppressor genes, which function in control of cell growth, cell arrest, DNA repair, and apoptosis of abnormal cells. Both oncogene activation and suppression of the tumor suppressor genes can be caused by mutations in the sequence of DNA or through something called chromosomal rearrangements. In either case, both will actually promote abnormal cell growth and division, which could lead to more genomic instability and eventually cause cancer. In epigenetics, the DNA sequence does not actually change. So if you look at the nucleotides of the DNA, they stay exactly the same. But rather than affecting the sequence, it rather affects how the sequence is actually expressed by changing the activation or deactivation of promoters that affect the copy number. And those effects on the copy number could silence things like certain types of genes expressions. An example of that would be silencing a tumor suppressor gene, which also would aid in the development of cancer. The second main component of paraneoplastic stiff person syndrome is the immune system. So the immune system is a defense that the body has to defend against infection or disease. Some parts of the immune system look for unhealthy cells or something that is foreign to the actual body, while other parts of the immune system send signals or messages to other cells in the body about an attack, or others work to work to attack and destroy microorganisms that can actually cause infections. So these microorganisms are things like bacteria, viruses, fungi, parasites, or in some cases, we're talking about unhealthy cells like cancer cells. There are two divisions of the immune system, the innate immune system and the adaptive immune system. The innate immune system refers to a nonspecific defense mechanism that come into play immediately or within hours of an antigen's appearance in the body. So these mechanisms include things like physical barriers such as the skin, chemicals in the blood, and immune system cells that attack foreign cells of the body. The adaptive immune system is a subsystem of the overall immune system that is composed of highly specialized systemic cells that process and eliminating pathogens or preventing their growth. The adaptive immune system is sometimes called the acquired immune system, mainly because the pathogenic receptors that the organisms have are acquired through their lifetime. And this creates a pathogen-specific system, where the innate immune system is a naturally occurring immunity that is found in all vertebrates. There are different parts of the innate and the adaptive immune systems. So some of those things are cells, and other things are going to be parts called like cytokines. So if we're looking at the different types of cells that make up the immune system, the first one we'll go over is lymphocytes. Lymphocytes are part of the adaptive immune system. So you have different types of lymphocytes. The first one would be your B cells or your B lymphocyte. So these B cells were actually the cells that transform into plasma cells that synthesize antibodies that specifically bind to antigen to initiate an immune response against that antigen. You also have your T cells. So there's a couple types of T cells. You have cytotoxic T cells or CD8 cells. And then you also have your helper T cells or your CD4 T cells. So cytotoxic T cells are ones that actually look for antigen fragments bound to something called a major histocompatibility complex, or the MHC. So if the MHC molecule is actually displaying fragments that match the receptors on the actual cytotoxic T cell, that T cell will attack that cell with an immune response. Helper T cells can also be activated, or they can also help with activation. So helper T cells are ones that help activate B cells to secrete antibodies, macrophages to destroy and ingest microbes, but they can also help to activate cytotoxic T cells to help kill infection or target cells as well. The last type of lymphocyte are your natural killer cells, and in some cases we just refer to them as NK. So your natural killer cells are lymphocytes that actually attack cells that have defective self-markers. So each one of us has a unique set of major histocompatibility complex, or MHC antigen, on all of our cells that identify us as unique individuals. These cells are ones that function, or the natural killer cells are the ones that actually function at identifying cancer as non-self. So the main difference between these lymphocytes as compared to the T helper cells and the cytotoxic T cells and the B cells, or the natural killer cells, are actually part of the innate immune system. So next we have the myeloid cells. Your myeloid cells, again, are going to be part of the innate immune system. These are macrophages, which are phagocytic cells that actually can engulf and enzymatically break down microorganisms and foreign material. You also have dendritic cells. So sometimes we refer to dendritic cells as just a DC. So dendritic cells actually serve as a function of engulfing cells that break down material and then just display those actual components on the cell surface. So they actually take parts of different types of microorganisms or cells that are not going to be recognized as self. They break them down and they present those on the surface of the actual cell itself. So that's why we sometimes refer to them as antigen presenting cells. Once they engulf cells or materials and they're presenting them, they can actually migrate to local lymph nodes, bringing them into contact with other cells like the T lymphocyte, the B lymphocytes, and they can activate them for further actions. if the lymphocytes actually are displaying the same type of receptors or they match the receptors of the T cells and B cells, is the only time when they will be activated. So you have also part of the immune system, which would be the granulocytes, which are part of the innate immune system. And all part of the granulocytes are going to be ones that actually take part in the inflammation response. So first you have your neutrophils. Neutrophils circulate in the blood. When there's an injury or tissue invasion of a foreign agent that occurs, neutrophils will actually leave circulation, go to the site of inflammation, and at that site kill pathogens by phagocytosis. We also have eosinophils. Eosinophils participate in immune reactions to parasites, but they're also mediators of allergic reactions and in asthma. Basophils are going to be the last granulocytes. Basophils and their tissue counterparts, mast cells, also participate in allergic reactions and in the defense against parasitic infections. The last part of the immune system that we'll cover would be something called cytokines. So cytokines are going to be any number of substances such as interferons, interleukin, or growth factors, which are secreted by cells of the immune system that have an effect on other cells. Paraneoplastic stiff person syndrome is caused by an autoimmune response to cancer. So it is important to cover what a normal immune response to cancer looks like. So this is summarized in figure 2. So cancer cells have gone through significant changes, either through mutations or epigenetics. That causes them to express proteins that are not normally expressed. Those proteins label cancer cells as not self, which initiate an innate immune response with natural killer cells, macrophages, and dendritic cells that result in the death of those cancer cells. So tumor cells are proteins that are degraded into smaller peptides, and endosomes and lysosomes in the dendritic cells, or the antigen-presenting cells, are subsequently expressed on the surface of the MHC class II, which can be recognized by your CD4 or your T helper cells. And those T helper cells assist B cells to proliferate and to mature into the antibody-producing plasma cells. The antigen-presenting cell can also activate your cytotoxic T cells to initiate an immune response. So both the production of antibodies and the cytotoxic T cells will have an immune response, actually inhibit the growth of that tumor. So we understand that all cancers do have an immune response. In most cases, the reason that it's not enough to keep the cancer at bay is because the cancer is actually replicating so fast that the immune cells cannot keep up. There is an immune response that is going to be tied to all cancers. So paraneoplastic syndromes are a group of disorders that are initiated by an abnormal immune response to malignant tumors or something called neoplasm. So this syndrome is thought to happen when cancer-fighting cells like T cells or antibodies actually target normal cells of the nervous system. So this syndrome is fairly rare due to the fact that it affects 1 in 10,000 patients. So paraneoplastic stiff person syndrome is more common in women than in men, and they're usually diagnosed at an advanced age. Usually the average age is 58. So paraneoplastic stiff person syndrome is most common in patients that are having breast cancer or small cell lung cancer. So even though it is not common, it has been tied to other cancers. One of those cancers is, in fact, colon cancer. So this was in an article where they had an 82-year-old female patient who was showing signs of uh, paraneoplastic stiff person syndrome, and it was a precursor to the diagnosis of her colon cancer. So paraneoplastic stiff person syndrome is different than traditional stiff person syndrome, mainly due to the fact that paraneoplastic stiff person syndrome is tied directly to cancer. Another difference is paraneoplastic stiff person syndrome produces something called amphiphysin antibodies, whereas traditional stiff person syndrome produces glutamatic acid decarboxylase or GAD antibodies. This difference plays a big role in the treatment of these two disorders. Lastly, The difference is extremely important because paraneoplastic stiff person syndrome is associated with cancer, and many times these symptoms arise before the cancer is actually diagnosed. So if it is mistakenly diagnosed as traditional stiff person syndrome, then patients have run the risk of actually missing out on a diagnosis of early stages of cancer. So we'll cover other key differences on the next slide. Both Table 1 and Figure 5 were taken from an article titled Stiff Person Syndrome with Amphiphysin Antibodies. This article was published in Neurology in 2008. Both are dealing with the comparison that is seen between paraneoplastic stiff person syndrome and traditional stiff person syndrome. Some of the biggest differences that are on Table 1 are is that paraneoplastic stiff person syndrome seems to affect women more than men when compared to traditional stiff person syndrome. The average age on onset is higher. It's 58 for paraneoplastic, and when compared to traditional, which is 44. And maybe, again, the most important is that paraneoplastic stiff person syndrome is highly associated with cancer, while traditional stiff person syndrome is not. Figure 5 also shows a comparison of the two syndromes. So, and it's mainly talking about the parts of the regions or the regions of the body that are affected by this disorder. So, if you're looking at paraneoplastic stiff person syndrome, it's usually affecting the neck and the arms, while more traditional stiff person syndrome is affecting the legs. Again, this is important because both syndromes are rare and must properly be diagnosed to be effectively treated. Also, the fact that paraneoplastic syndrome is associated with cancer, misdiagnosing it could prevent discovery of the cancer, and also that the discovery of the cancer the patient might actually have. So, a person or a patient that is diagnosed with paraneoplastic stiff person syndrome can suffer from the following symptoms: painful extremities, truncal or facial spasms, which are uncontrollable and often painful muscle contractions of the trunk and facial regions. Symmetric axial muscle rigidity is when the muscles around the spine stiffen and become very rigid, and they produce distorted posture, and that can affect coordination of movements and different things like that. Those muscles are affected can actually lead to mild atrophy and also muscle weakness. Some patients that also have paraneoplastic stiff person syndrome can actually suffer from apnea, which is when patients actually stop breathing. This happens usually due to muscle contractions in the trunk, where those muscles contract so much that it actually brings a patient where they're not able to breathe. And in some cases, and in articles that I've read, this has actually led to some of the deaths of some of those patients. Lastly, they also have encephalopathy, which is damage to the brain causing malfunctions that has caused death in some patients as well. So when we start talking about the immune response or the autoimmune response that's actually associated with paraneoplastic syndrome, you're going to see that this is going to be one of those things that can happen because it can cross the blood-brain barrier. So earlier, we discussed a normal immune response to cancer. Now knowing more about paraneoplastic stiff person syndrome, we'll cover how it responds to cancer that leads to symptoms that were just discussed. In Figure 4, this is proposing a pathogenesis of paraneoplastic neurological disorder. So this usually is going to affect a tumor that is not involving the nervous system, that expresses a neuronal protein in the immune system, or that the immune system actually recognizes as non-self. Tumor cells that have gone through apoptosis and then are phagocytized by dendritic cells then migrate to the lymph nodes, where they present the antigen and activate antigen-specific lymphocytes like your cytotoxic T cells, your T helper cells, and then also your B cells. The B cells will mature into plasma cells that produce antibodies against the antigen. In cases of paraneoplastic stiff person syndromes, those would be amphiphysin antibodies. The antibodies of cytotoxic CD8 or cytotoxic T cells or CD8 cells, or both, will actually slow the growth of the actual tumor. But they also react with regions of the nervous system outside the blood-brain barrier. In this illustration, the antibodies are reacting with the voltage-gated calcium channels of the neuromuscular junction. And this would cause symptoms where you're dealing with muscle contractions and different things like that. In some instances, the plasma cells and the cytotoxic T cells can actually cross the blood-brain barrier and attack the neurons expressing antigen that they share with the tumor. And that's where you're going to see where it has some effects on brain damage, different damages to the brain tissue as well, could lead to other system failures. Because paraneoplastic syndrome is a rare disease, it is not a lot of data and treatment, and it is still one of the areas being actively researched. According to an article that is titled Stiff Person Syndrome with Amphiphysin Antibodies, published in Neurology in 2008, the most effective treatment was performing plasmapheresis, which is a procedure which involves removal of treatment and the return of the blood, the removal, treatment, and return of the blood to the body to remove antibodies, thereby hopefully prevent from the antibodies from attacking their target. So the plasmapheresis is usually performed with steroids like cortisones and prednisone to help treat the inflammation as well. Primary treatment still for paraneoplastic stiff person syndrome is surgery or chemotherapy to try to remove the tumor to help prevent this or stop the immune response from continuously happening. The treatment to remove the tumor was also evident in an article titled Reversible Stiff Person Syndrome Presenting as an Initial Symptom in a Patient with Colon Adenocarcinoma, published in 2010. And in this article, it talks about an 82-year-old female patient who had symptoms of paraneoplastic stiff person syndrome that improved after she was diagnosed with colon cancer and she'd gone through colon resection surgery and removed the cancer. So traditional stiff person syndrome is different because it's usually treated with high doses of the diazepam for anxiety, baclofen for muscle spasms, and intravenous immunoglobulins to inhibit GAD antibodies. Lastly, they also use plasmapheresis to actually remove the antibodies to help prevent the autoimmune reaction as well. Even though these two diseases are similar, they do have specific treatments that require them to be diagnosed properly. There are active areas of research that are going on to help patients with paraneoplastic stiff person syndrome as well, and as well as also other neurological disorders. One of the areas that needs more growth is understanding the immunopathogenesis of these disorders. Being able to better understand the mechanism of the disease will allow for better diagnosis and treatment. Treatment is also being studied. They're understanding that if there's other immune therapies that would be more effective for treating these disorders, not only are the treatments actually being studied, but the timing and the diagnosis of the treatments are also being considered. Because what they found is that earlier diagnosis and treatment have patients that have a better prognosis. So again, primary treatment for paraneoplastic syndrome is first to remove the tumor either by surgery or chemotherapy. And in some cases, both treatments are actually applied. There have been studies that have shown that chemotherapy cycles have actually made symptoms of paraneoplastic stiff person syndrome worse. If these studies do show the symptoms get worse with chemotherapy, it could affect how disorders are treated in the future and also should require further studies of things like cancer and then also paraneoplastic stiff person syndrome. Before I had experiences before the experience that I actually encountered with my grandfather, I never heard of paraneoplastic stiff person syndrome. But those experiences are what led me to do some research about this disease and for this presentation and also for personal interest. After the research, I found many times paraneoplastic stiff person syndrome is commonly undiagnosed or misdiagnosed due to the rarity of the disease. The fact that paraneoplastic stiff person syndrome is a precursor to different types of cancer, it's extremely important that it's diagnosed properly to ensure that patients have a better chance at identifying cancer early in development so that it's easier to treat. The importance of properly diagnosing paraneoplastic stiff person syndrome also plays an important role in how it's treated because treatments vary on the disease. Receiving the correct treatment or the incorrect treatment would actually be ineffective. So the rarity also of paraneoplastic person syndrome means that there are aspects of the disease that are not well understood or defined, such as the pathogenesis and effective treatments. As more research is performed, we will be able to better understand the pathogenesis of paraneoplastic neurological disorders, which would allow for more accurate diagnosis and effective treatments. Lastly, other diseases can be caused by an autoimmune response to cancer, adds to the complexity of cancer itself. Cancer is one of the most challenging diseases to treat because of the rapid evolution of cells and the heterogeneity that is seen in the tumors. But if cancer is able to be treated and cured, but some people still have serious or even lethal side effects of diseases caused by cancer or that are associated with cancer, it just makes a case for more research on cancer and other diseases such as paraneoplastic stiff person syndrome.